Dementia is a general term for a decline in mental ability, encompassing a range of symptoms that affect memory, thinking, and social abilities. This decline is severe enough to interfere with daily life, making everyday tasks increasingly difficult. Dementia is a growing concern, affecting millions worldwide, and the numbers are expected to rise as the global population ages. It is not a normal part of aging, but rather a result of various diseases and conditions. Dementia is caused by damage to brain cells, which disrupts their ability to communicate with each other. This damage affects the brain's ability to communicate, leading to the symptoms we associate with dementia. Dementia impacts not only the individual but also their families, creating a ripple effect of emotional and practical challenges. Caring for a loved one with dementia can be challenging, requiring significant time, effort, and patience. It can lead to emotional, physical, and financial strain, affecting the well-being of caregivers. However, understanding the early signs of dementia is crucial for timely intervention. Early detection allows for timely intervention and support, which can significantly improve quality of life. There is currently no cure for dementia, but treatments are available to manage symptoms. However, early diagnosis and treatment can slow its progression, helping individuals maintain their independence longer. It can also help manage symptoms, providing a better quality of life for those affected. This video will delve into 9 early signs of dementia that you should not ignore, offering insights into what to look for. If you notice any of these signs in yourself or a loved one, seek professional help immediately to ensure the best possible care. Everyone forgets things occasionally. It's a common experience to misplace your keys or forget an appointment. It's a normal part of life and happens to everyone at some point. However, frequent or worsening memory lapses can be an early sign of dementia, which is more serious. This goes beyond forgetting appointments or misplacing keys occasionally. Individuals experiencing dementia-related memory problems may have trouble recalling recent events or even familiar faces. They may forget conversations or important dates, leading to confusion and frustration. They might repeat themselves or ask the same questions multiple times, not realizing they've already done so. These memory problems stem from damage to brain regions associated with memory, particularly the hippocampus. The hippocampus, a seahorse-shaped structure deep within the brain, plays a crucial role in forming new memories and retaining them. As dementia progresses, the hippocampus deteriorates, making it harder to form new memories. This deterioration leads to increasingly frequent and severe memory lapses, affecting daily life. It's important to distinguish between normal age-related memory changes and dementia, as the latter requires medical attention. While occasional forgetfulness is common, consistent and disruptive memory problems warrant attention and should not be ignored. If you or someone you know experiences persistent memory difficulties, consult a healthcare professional for a proper evaluation and guidance. Most of us perform daily tasks on autopilot. We cook, clean, dress, and drive without much conscious effort. However, for individuals in the early stages of dementia, these routine tasks can become surprisingly difficult. They may struggle to follow recipes they've used for years. Using appliances like microwaves or washing machines might become confusing. Driving to familiar locations could turn into an overwhelming challenge. These difficulties arise from the disruption of neural connections in the brain. Dementia disrupts the communication pathways responsible for coordinating familiar actions. This disruption makes it hard to perform once routine tasks. If you notice a loved one struggling with activities they used to handle easily, don't dismiss it as a sign of aging. It's essential to seek professional guidance to determine the underlying cause and explore potential interventions. Mood swings and personality changes are common in people with dementia. They may become easily irritated or agitated. Anxiety, depression, and paranoia are also common. Previously, social individuals might withdraw from others. They may lose interest in hobbies they once enjoyed. Their personalities might seem to shift, leaving loved ones feeling like they're interacting with a stranger. These emotional and behavioral changes stem from damage to the frontal and temporal lobes of the brain. The frontal lobe is responsible for executive functions, emotional regulation, and social behavior. The temporal lobe plays a role in memory, language, and emotional responses. As dementia progresses, damage to these areas can lead to unpredictable moods, personality shifts, and difficulty controlling impulses. It's crucial to remember that these changes are not intentional. They are symptoms of a brain disease and require understanding and compassionate care. Judgment and decision-making. When prudence falters, people with dementia often experience a decline in judgment and decision-making abilities. They may make impulsive purchases or give away money to strangers. They might neglect their personal hygiene or make unsafe decisions. For example, they might leave the stove on or forget to lock the door. They might dress inappropriately for the weather or wander off without telling anyone. This decline in judgment stems from damage to the frontal lobe, which is responsible for planning, reasoning, and impulse control. As dementia progresses, the frontal lobe's ability to function properly is compromised. If you notice a loved one exhibiting poor judgment or making decisions that seem out of character, it's important to address the issue promptly. Consult a healthcare professional to discuss your concerns and explore options for ensuring their safety and well-being. Communication breakdown. Trouble following conversations. Communication relies on a complex interplay of cognitive functions. Dementia can disrupt these functions, leading to difficulties with language and communication. Individuals in the early stages of dementia may have trouble following conversations. They might lose track of what's being said or forget the topic of discussion. They might repeat themselves or ask the same questions multiple times. They may also have difficulty finding the right words or understanding complex sentences. These challenges arise from damage to the brain's language centers, including areas involved in speech production, comprehension, and semantic processing. As dementia progresses, communication difficulties typically worsen. If you notice a loved one struggling to keep up with conversations, be patient and understanding. Use simple sentences, speak slowly and clearly, and give them time to process information. Disorientation, losing bearings in time and space. Disorientation is a common symptom of dementia. People with dementia may become confused about the time, date, or day of the week. They may forget where they are or how they got there. They might get lost in familiar places, even their own homes. They might arrive late to appointments or miss them altogether. This disorientation stems from damage to brain regions involved in spatial and temporal processing. The hippocampus, which plays a crucial role in memory and spatial navigation, is particularly vulnerable to dementia-related damage. If you notice a loved one exhibiting signs of disorientation, it's important to ensure their safety and provide reassurance. Avoid arguing or trying to force them to remember. Instead, gently guide them back to the present moment and offer support. Recognizing faces and objects. Challenges in perception. Vision problems are common in older adults, but certain visual difficulties can be signs of dementia. People with dementia may have trouble recognizing familiar faces, even those of close family members. They may also have difficulty identifying everyday objects. For example, they might mistake a fork for a spoon or a toothbrush for a hairbrush. They might have trouble distinguishing between colors or seeing objects in their peripheral vision. These visual difficulties can stem from damage to the brain's visual processing centers, located in the occipital lobe. Dementia can disrupt the brain's ability to interpret visual information, leading to problems with object recognition and spatial awareness. If you notice a loved one exhibiting these visual difficulties, consult an eye doctor and a neurologist to rule out other potential causes and discuss possible interventions. Motor skills and senses. Subtle but significant changes. Changes in motor skills and senses can also be early signs of dementia. These changes might be subtle at first, but they are significant indicators. Individuals may experience tremors or shakiness in their hands, which can make simple tasks more challenging. They might become clumsier, dropping objects more frequently. This can be frustrating and sometimes even dangerous. Their handwriting may change, becoming smaller or more irregular. This can be a noticeable sign for those who are close to them. In addition to motor skills, changes in the sense of smell can also occur. This is often overlooked but is a crucial symptom. Dementia can affect the olfactory bulb, the part of the brain responsible for processing smells. This can lead to confusion and frustration. As a result, individuals may experience a decreased sense of smell or have difficulty identifying familiar scents. This can impact their daily life significantly. These changes in motor skills and senses are often subtle in the early stages of dementia. However, they are important to recognize. However, they can gradually worsen over time, impacting an individual's ability to perform daily tasks and engage in their surroundings. This progression can be challenging for both the individual and their loved ones. If you notice any of these changes in yourself or a loved one, it's crucial to consult a healthcare professional for a comprehensive evaluation. Early intervention can make a significant difference. Early detection and diagnosis are essential for accessing available treatments, managing symptoms, and planning for the future. Taking action early can improve quality of life and provide much-needed support. Let us know down below if you are taking care of a loved one with dementia. Share your story. We are here to support each other. See you in the next video.